Hello, everyone. Welcome to our Public Health Champions virtual forum. Thank you for joining us. I am now going to turn over our time to our moderator, Troy Willams, who is the Executive Director of Equality Utah.
Hey, everybody. Thank you so much. Appreciate that, Chelsea. Thank you to the Utah AIDS Foundation for hosting tonight's forum. We're here tonight to discuss one of the few outstanding injustices that gay and bisexual men continue to experience in our culture. It's a form of discrimination that not only targets gay and bisexual men, but also prevents people in dire need from blood donations from receiving the life-saving care that they require. Recently, the American Red Cross declared a national blood crisis. People are in need, but they can't access available blood, and gay and bisexual men who want to give are restricted. So let's dive in. Let's discuss the history of the ban, the stigma that gay men and bisexual men face, what we can all do about it, and also how the Utah AIDS Foundation can continue to be a resource ensuring health equity issues in our state. And we also want you to join the conversation as well. So if you have questions for our panelists, please don't hesitate to throw them into the chat. So our panelists tonight, first up, we've got Dr. Matt Bryan. He completed his medical training at Chicago Medical School at Rosalind Franklin University and his internal medicine residency at Rush University in Chicago, Illinois. In 2015, he moved to Utah with his family to start an outpatient primary care physician as an outpatient primary care physician with Intermountain Healthcare. And since 2019, he has served as the Associate Medical Director of LGBTQ plus health at Intermountain. His primary goals are to improve quality of care and address health inequities in the LGBTQ plus population. Also, we've got Senator Derrick Kitchen. Senator Kitchen is a small business restaurateur. He was one of the 6 plaintiffs in the historic Kitchen v. Herbert case, which brought marriage equality to Utah an entire year and a half before the Obergefell decision, which brought marriage equality to our entire country. Derrick served as a Salt Lake City Council member from 2015 to 2018. And since January 2019, he represents Senate District 2 in our Utah legislature. So, Senator Kitchen and Dr. Bryan, welcome.
Hi, thanks for having us.
All right.
Great to be here.
Cool. Let's jump in. Dr. Bryan, let's start with you. What is the current policy on blood donation for gay and bisexual men in America?
Yep. So currently the FDA recommendations or requirements state that if you identify as a man, this is self-identification. If you self-identify as a man and you've had sex with another man within the past 3 months, you are deferred from donating any blood products for the 3 months. And this has changed over time. And this is the most recent iteration is 3 months.
Okay, so 3 months. You cannot have sex before donating blood.
Yes.
Okay. All right. That's a long time for some of us.
Right.
I know. All right. Well, jumping backwards in time, how did the initial ban come into being? What's the history of this?
Yep. So in 1983 is kind of when the HIV AIDS epidemic was, people were starting to pay attention to it and notice it. And if you think about it, in that time, there was a lot of fear surrounding HIV and AIDS. We didn't know necessarily how it was transmitted, and there weren't great treatments, and there wasn't great testing. So I think initially in 1983, FDA said, you know what, if you're a man who's ever had sex with men, let's just take it all off the table and reduce that risk from any HIV transmission to anyone who needs to receive blood products.
Sure.
And I think at the time that was probably the right decision because we want to protect everybody. And if we didn't know enough about this virus, let's protect everyone and kind of make a conservative approach to it. The issue is it wasn't updated it didn't kind of keep up with technology and science and medical treatment, testing and treatment. So that ban was in place up until 2015, and then they reduced that. Instead of a lifetime ban, it's rather a deferment. You couldn't, a man who's had sex with men in the past year was deferred that 12 months until they could donate blood. And then again, it was updated. The policy was updated again in the beginning of the pandemic in 2020, and it was shortened to 3 months. That's the current iteration that we have.
Okay.
So that's kind of the history of policy changes over time.
Right. And what's the kind of science behind, anybody who donates blood? I mean, how do we know, how do we test the blood? Do we know that it's healthy, that it's good for transfusions?
Oh yeah, it's tested for, lots of bloodborne pathogens. And I think the maybe what people don't have a full understanding of is that sometimes the blood tests are not 100%. And one of the issues that contributes to that is a term called the window period. And kind of in quickly describing it, there could be a period in which if someone is recently exposed to some bloodborne pathogen, there might be a period in which that test actually shows that it's negative, even though it's positive within the person's body. And so if there's a window period, potentially someone who's, say, recently infected with HIV donates their blood, we test it, it's negative, it looks negative, falsely negative, but it turns out they actually have it, and the person who receives those blood products could potentially get HIV. The good news is over time, the tests have improved, right? Back in our initial HIV testing, that window period was up to 4 to 6 weeks or even longer. So that's why they said, you know what, let's be conservative here and say forever you can't donate, which is a little much. But as testing has gotten better, that window period is now down to 7 to 10 days.
Oh, okay.
Not months. But it still took decades for that lifetime ban to go down to a 1 year, and then 7 more years or 5 more years to lower it to the 3 months.
Okay. All right. So that's the logic. They're concerned about this window. They're concerned about not knowing, but the science but they're not keeping up with the science is what you're saying.
They hadn't been, yes.
All right. So, okay, then Senator Kitchen, let's say, you're talking to one of your colleagues on the Hill, and generally they may say something to you like, hey, I don't like to discriminate, but I don't like the idea of men having sex. And I don't like the idea of men who have sex actually giving blood. How do you engage with people, who maybe aren't educated, and you want to bring them along on this journey with us?
Well, I appreciate that question, and it's an angle that I have to take on a lot of issues in the Utah legislature, considering the current makeup of our lawmakers in the state of Utah. But I think the best way to engage folks is just to pull them in and meet them where they're at. And so, to your point, Troy, a lot of folks are trying to be generous and trying to be kind and gentle, while also carrying with them, I think, maybe some fears or misunderstandings about the LGBTQ community broadly, and especially about gay men who have sex with men. And so I think the approach that I've always taken with my colleagues on the Hill is to sit down and try to, again, meet them where they're at. I think the biggest issue for me, and we can talk about this in a minute when I talk about my joint resolution that I ran this year, but reminding the lawmakers of the current reality in the United States. Obviously we are currently dealing with the coronavirus pandemic, but obviously back in January, we were experiencing the Omicron surge. And I remind my colleagues that we have a blood shortage in the United States, and that actually weakens our healthcare system overall. And the fact that, something like I have on my notes here, 4.5 million people or so are currently unable to donate because of the current policy by the Food and Drug Administration prohibiting gay men who have sex with men from donating blood within 3 months of having intercourse with another man. And when we're in a blood shortage, it's important for us to be mindful of the fact that these policies aren't actually helping anybody. They certainly aren't helping our healthcare workers who are desperate for the supply of blood, and they certainly aren't helping gay men and families of gay people who, would like to step into a role of leadership and participate in solving the crisis, right? And that while, yes, ultimately we have seen progress over the years, we are not operating under the federal policy that existed in the 80s, where men were prohibited outright. And we've made improvements, like Dr. Bryan mentioned in 2015, eliminating the lifetime ban and leaning on a year-long ban. And then again, shortening that down to 3 months. Those are all important steps in the right direction. But right now, the disparity is just so clear, and it's not based, the current ban for men that have had sex with men in the last 3 months isn't based in sound science. And so I think it's clear that this is a case of discrimination. And so I guess I just make the case to conservative lawmakers that ultimately this is about individual privacy, and that we wouldn't discriminate against, let's see, a member of the LDS faith for the way that they live their life, if it wasn't based in reality, or we wouldn't discriminate against men, heterosexual men, or, people that have a certain occupation just simply because we don't like it, right? So I think we just need to be clear that as policymakers, it's our job to check our biases at the door and to focus on crafting good, sound public policy that is rooted in what is in the best interest of our general public at large. It doesn't always work, Troy, as you know, but it's certainly an approach that I try to take on many issues that impact our community.
Yeah. If you have a question for Dr. Bryan or Senator Kitchen, throw it into the chat and we will answer them for you. So I guess at the core of this issue, and I'd love you both to address this, what we're really talking about is a stigma that justifies the ongoing restrictions and bans. And would you both address how you see stigma playing into this restriction?
I can grab that first. So I see stigma in healthcare. I deal with that every day of my life in my work. And, LGBTQ folks and, gay and bisexual men who have sex with men included in that umbrella, face a ton of disparities compared to non-LGBTQ folks. And, access to healthcare is a huge problem there, and stigma is a huge problem there. And how do we see stigma, or how do I see stigma? How is it represented when a patient comes to me? And it's, folks have trouble getting affirming care. They have trouble finding providers who can understand where they're coming from and why they might struggle to see the doctor, or what kind of other issues they've had in seeing a provider in the past. And it's just kind of another slap in the face, another layer of stigma when you say, okay, you want to go do something good. You're not even helping yourself, right? By giving blood, you're trying to help someone else. You're trying to help someone else in the pandemic and save someone's life. But then you can't do it because you've been grouped in as someone who's high risk, when in fact you might not be.
You're a threat. We're threats.
Yes.
Right? Yeah. Senator Kitchen, you want to weigh in?
Yeah, the stigma question is big because, this creates enormous barriers for people accessing healthcare. And, we already have enough barriers, from cost to location and what have you, coverage. I mean, we already have so many structural barriers that when it comes to a federal policy that isn't actually rooted in what's best for the general health of our people, it's really important that we try to hit this head on. And stigma is something that we can't address it overnight. And it's not something we can we can't have a rational conversation with everybody about removing their stigma. But I do think that, visibility is really important, and bringing to the forefront some of the issues that we are facing that contribute to making stigma worse, perhaps. If you go try to donate plasma, for instance, which a lot of people do just to earn a couple extra bucks here or there, you can't donate blood if you're a gay man, right? I know that a lot of young people are really concerned about not only the blood shortage, but the fact that we have government agencies, both federally and locally, that do have policies that are targeting or excluding LGBTQ people. And so part of my effort this year with the resolution, which I mentioned, was to bring this conversation forward. And I believe that the way around existing stigma is to sort of shine a bright light on it, and just really call on people to begin to think about their assumptions. And when they are provoked to think about it on their own, perhaps they'll come to the conclusion on their own, right? And so I think that there's a lot we can do. We certainly need to keep the pressure up, especially when it comes to life-saving blood, right? But yeah, stigma is something that exists everywhere. And, the three of us as, out gay men, we have experienced that throughout our lives, right? And so I think the theme of coming out and providing visibility is key to overcoming stigma.
Okay, thank you, Senator Kitchen. We have a question that's come in from Anonymous. Was the changing of rules at the beginning of the pandemic due to necessity or a final realization of the science? Thanks for that question.
I can't speak for the federal government. Perhaps Dr. Bryan has more to add to this, but I certainly know that there's been awareness of the blood shortage for a while. It's ebbed and flowed depending on what's going on at the national level, but certainly a pandemic will amplify some existing vulnerabilities in our healthcare system, right? And so I think that was certainly part of it. I also want to acknowledge that while we're calling on the Food and Drug Administration and other federal agencies to reduce stigma by eliminating this arbitrary ban, I think it's important to acknowledge that the federal government is currently engaged in something that's known as the advanced study, and perhaps Dr. Bryan can speak to that a little bit as well. But they are surveying a couple thousand gay men nationwide about possibly eliminating the restriction altogether, the deferral. And so we're, anxiously awaiting the results of the advanced study because I imagine that it will be favorable to men who have sex with men and their ability to donate blood. But yeah, I'm certain that the pandemic as well as the pending results from the advanced study probably triggered the feds to make this decision. Perhaps Matt can speak to this a little bit more.
Yeah, tackle it.
Yeah, I mean, I would, again, it's kind of putting words in their mouth, but I can't speak for them either, like Derrick. But the science has been there, the testing, knowing that you don't need a year of abstinence in order to make sure someone doesn't have HIV, that's well past the window period. So I think that information, that data, that had been known. I think it was the necessity of the pandemic and then the intense need for blood and the severe blood shortage that really pushed it over.
And we're still having that. I mean, the American Red Cross says we're having a national blood crisis. So what are we looking at in terms of the need?
I actually don't know exactly how far in the negative we are with our blood, but you're right that it's still an issue. It's absolutely still an issue.
Okay. All right. So Senator Kitchen talked about this a little bit about how he engages his colleagues. But Dr. Bryan, how about you? How do you mitigate the fears that justify the ban, and especially when you're talking to people who haven't maybe thought through this, but are holding on to old ideas or old stereotypes?
Yeah, I think it's the same kind of idea of, I think Derrick described it as meeting people where they're at. I think it's helpful to figure out what is their concern, what exactly is their fear, and it's kind of introducing facts and data and what we actually know to be real, and little by little just introducing that into the conversation, and it's a lot of times it's simply just calling out the disparities that exist, right? And right. The reduced access to healthcare in general. So that usually opens eyes and minds pretty quickly because they just don't know.
So when it comes to the FDA and the folks making these decisions, I mean, who is it? Are there scientists making these decisions, or is it politicians?
They have a panel, and I couldn't tell you exactly what the makeup of that panel is, but I know that they are professionals, and it's the federal government. Almost every decision is going to be informed by politics to some degree, but I know that they insulate themselves from some of these decisions by leaning on experts and having a well-documented and intense process, which I believe the advanced study, when it's finalized, will be that process that will give some maybe fence-sitting politicians the courage to take a firm stance one way or the other. And since I have the floor, just briefly, you asked a question a moment ago about where we're at in terms of the shortage.
Yeah.
While I can't speak to that specifically today, I just dropped in the chat here a press release from the Red Cross from January, where they identified that since the COVID-19 pandemic began in 2020, they had seen about a 10% drop in donations, and that they're especially desperate for type O positive and type O negative blood. So for what that's worth.
Right. Okay. All right. Excellent. And the Biden administration now is speaking positively about eliminating the ban. They said, I believe the quote was, they want to make decisions based on science, not fiction or stigma. So that will go a long way. We're hoping, right? If they can get this done in the next, couple of years. Right?
The Biden administration has a long list of to-dos in the next, 18 months or so, right? So, hopefully they can get it done.
All right. We have some questions coming into the chat. If you have a question for Dr. Bryan or Senator Kitchen, go ahead and just drop it in there and we will read it. Tyler is asking, can you speak to the rates of HIV in men who have sex with men versus other populations that the FDA states as their reasoning?
There's definitely a higher rates. I wouldn't be able to get the exact quote right now, but rates in MSM, men who have sex with men, rates of HIV are much higher than the general population. The trouble is, not all men who have sex with men are created equal. They don't all have the same actual risk of being exposed to HIV. And therein lies a lot of this problem, right? So currently we're saying, if you're a man and you've had sex with men in the past 3 months, right, you just can't donate blood. You can't do it because you're probably slutty. That's the trouble. When it really what is a much better gauge of someone's risk, it's individual, right? It's that one person's behavior and what they've been doing. And that's a much more appropriate, accurate way to determine if someone is potentially at a higher risk of being exposed in the past 3 months. So rather than saying you're a man and you've had sex with a man, you probably have HIV, right? There's stigma right there. Exactly. You say, okay, well, how many partners have you had? Do you use condoms? Are you on PrEP? Are your partners on PrEP? Do you inject substances and have sex? Are both of those things risk factors for you? So in the absence of just, blindly saying, oh, you're gay or bi, we don't want your blood. Yeah. That's the stigma that needs to be addressed. And that's, as Derrick mentioned, the advanced study, that's what it's looking at. It's looking into, I think, there's like 8 cities nationwide with 2,000 some participants. And these are in cities where incident new HIV infections happen. So kind of high risk areas. And the idea is, instead of saying you're gay, you can't do it, and looking at how many positive cases come through transfusions, they're going to say, okay, let's look at your risk. And there's going to be a lot of gay and bisexual men who are not high risk. And that takes that stigma out. So hopefully when those results come back, I believe it's the end of 2022 when they should be back. Hopefully it shows favorably and more people are allowed to donate.
How quickly do you think the FDA could move on a positive assessment from that study?
I don't know that. How quickly? I mean, it would. I believe the study results, the study findings will go to the FDA. Then they have to review it, and then make an assessment of what comes next, which could be, a larger scale study. So it might not be for a couple more years. That's hard to say. I'm not privy to any of those meetings, unfortunately.
And I'm not privy to any of those either, but I imagine that it'll be a series of administrative rule change that will take place, which could be done pretty quickly, right? And then perhaps a smaller list of possible legislative changes that would need to come from Congress, right? So, and that, might be proposed by the administration, or it may be, tossed over to, lawmakers to craft on their own. But I can imagine some quick changes, assuming that the advanced study produces what we imagine it might.
Okay. Throw your questions into the chat if you want to talk to Dr. Bryan or Senator Kitchen. We will answer your questions. We have an anonymous question came in. Can Dr. Bryan speak a bit more about the barriers that LGBTQ plus community faces in the medical community, and how agencies like the Utah AIDS Foundation can help patients and work with medical providers to overcome these barriers?
Yeah. Again, the disparities faced by LGBTQ folks there's a ton, right? It's, as I think Derrick mentioned, even before you even approach the medical system, there's, more likely to be, to not have a job, to not be insured, to be houseless. And all of those things impact your actual ability to have transportation, have payment for, and have the knowledge to know where to go, to even access to open the front door to receiving healthcare. And then from there, you have to actually find a provider who knows how to handle your health concern as an LGBTQ person, right? Does that mean, you already have HIV, someone who knows how to treat that, someone who knows about HIV prevention medications. Trans folks have a lot of very specific needs, right, related to hormone treatment and surgeries and mental health, and lots of issues there that a lot of providers never received any education about. So even when that person gets their foot in the door, they might hit 5 providers who don't know how to help them. Right. So I think it's kind of barrier after barrier after barrier. And that can be very discouraging. I have lots of patients who say, when they're a new patient to come to see me, and they say, I haven't been to see a doctor, a provider, anyone in years because XYZ happened to me last time I tried to get help.
Right.
And it's really, really sad. So what we need to focus on is make sure we have to make sure our providers know what they're doing, and then they're affirming, and not only just affirming the patient and say, hey, Fred, you have a husband. Cool. That's no big deal. Let's talk about it. Or your pronouns are she, her. Cool. That's awesome. But they also have to know how to handle the medical aspect of that too. So they got to be welcoming. They got to know the medical side of things. And that takes a whole bunch of education and time and effort in order to make sure we're educating providers that way. So if we have a safe space to go that's affirming for patients, and the providers have knowledge to actually take care of them, we need more of those places in the world, our country, but here in Utah, right? So that's one thing. I'm very happy and fortunate that the UAF is around, because they're moving to a new building. They're getting, which will allow them to expand out clinical services, affirming services, appropriate, comprehensive, competent services for LGBTQ folks. So exciting things to come coming down the line.
Yeah, you sparked something as I was listening to you. We've been talking about restrictions on men who have sex with men, but I imagine that these also extend to members of the transgender community in terms of donating blood. Correct? I would assume that's logical.
Yep.
Right. What
yep.
are we?
So all the regular the rules that I've seen, it's really whatever gender identity you have. So it's no one's checking your parts, no one's checking your driver's license. If you self-identify as male and your partners identify as male, that's who's being deferred for the 3 months. If someone identifies as a trans woman, I believe they're viewed as female and they're not included in the ban.
Oh, interesting. All right. Okay.
So I think it's interesting that the question and the answer from Dr. Bryan reminds me just how problematic the deep stigma is for the general health of people, whether you identify as LGBTQ or you're just a man who has sex with men, right? And, we obviously have a fair amount of stigma that we're trying to overcome, both at the cultural and societal level, but that sort of trickles down into internalized individual stigma, people feeling this deep sense of shame. And I think this is where the Utah AIDS Foundation has been really successful in a place like Utah, which has its own sort of cultural quirks and nuances that an outsider may not always understand. And we could talk about that later. But I just think the relationship building that the Utah AIDS Foundation has been able to engage in over the last couple of decades, actually, pulling into the conversation the Church of Jesus Christ of Latter-day Saints and other typically conservative groups that I think may not always agree on the politics or the conversation out in the community, but understand the deep impact of providing affirming services and accurate information and creating a space where people can come in and get tested and be engaged with experts, especially those at the lower end of the socioeconomic spectrum, right? And so I just wanted to, use this as an opportunity to plug the important work that's being conducted by the AIDS Foundation.
Yeah, absolutely. Okay, so this is a federal issue. The FDA needs to make the call. Senator Kitchen, what can we do on the state level to create this kind of change or a momentum toward change?
Yeah, this is a good question. Yeah, because you're right. This is a federal issue, right? And so the states, defer to the federal government on guidance here. And so we really need the federal government to step into the game and to get their act together. And then Utah, we have an opportunity, I think, to build the momentum, to put meaningful pressure, political pressure on our federal delegation. We have 2 senators, right? Lee and Romney. We have 4 members of Congress. They all need to be speaking to their colleagues on the right, on the Republican right, as well as, engaging with the federal administration, the Biden administration on this matter. I would like for our federal delegation to own this as an important issue, an important public health issue, separate from it being an issue related to the LGBTQ community, although I would love for them to step into a leadership role there as well. But I think ultimately, that was the aim of my joint resolution this year, was to get the Utah legislature, our local government, to stand tall on behalf of the gay men in particular in our state that should have access to contributing to the blood shortage, or to contributing to filling the gaps in our blood shortage, right? And so I think just building that political momentum is really important. In addition to my resolution, you're seeing all kinds of groups out there also try to build this momentum. I'm certain the AIDS Foundation is doing it. I'm sure Equality Utah to some degree is doing some work there. There's also a group called the Utah Center for Civic Improvement. They've penned a really important letter to our federal delegation outlining the reasons why Romney and Lee and others need to get behind lifting the ban and why it's important for them to speak up on the matter. But I guess that was a long-winded way of saying we really need the feds to jump into this.
Right. So phone calls to Senator Romney, phone calls to Senator Lee, and whoever your congressperson is will be helpful.
Yeah. And if I could just add a little bit of advice on what that might look like. A phone call is one thing, but speaking to your lawmaker about why it's important to you, rather than just speaking to the, high level, it's right, it's wrong, speak to why it matters to you, bring in those values. Why is it important to you as a person that we as Utahns are participating in addressing the blood shortage nationwide, and why lifting the ban on gay men who have sex with men from donating blood is an important value for us as Utahns. Speaking to it from a values-based perspective, I think, is always more effective when you're trying to persuade our typically conservative federal delegation.
So insulting them on Twitter, not a great strategy. Is that what I'm hearing from you?
I mean, it might feel cathartic for a moment, but you're not going to get very far.
Oh, okay. All right. I will change my tactics. All right. Okay, we have another question in the chat. And if you'd like to leave a question for our 2 guests, our 2 panelists, please throw it in the chat and we will ask them. From Amer, we have seen an increase in policy and hate speech from politicians, specifically focused on limiting health rights, as well as directed towards the LGBTQ community. Do you anticipate this continuing, and do you expect to continue in a lasting manner, such as what we're seeing with the Supreme Court and Roe v. Wade? Ooh, that's ominous. It's an ominous question.
Well, maybe I'll just jump into this a little bit, but from my perspective and that of many others, access to reproductive health care, honest, open reproductive health care is an LGBTQ issue, right? And so, and looking at the language from that leaked opinion is really concerning for me as a gay man, and many of us out here who have enjoyed a fair amount of legal progress over the last decade or so, right? And to see some of that language used in the leaked opinion really worries me about what the future might tell for some of those rights that we've achieved, right? So I do worry for affirmative healthcare for trans and other non-binary individuals in our community. I do worry about the ability for us to have nationwide protections and access to marriage equality, right? Those are some of the issues that do worry me at the moment, politically speaking. And that was a loaded question. First of all, there was a first part there. If you would maybe.
Yeah, absolutely. So we just talking about the increase in hate speech from politicians, specifically focus on limiting health rights for the LGBT community.
And I guess to answer that, we obviously saw House Bill 11 this last year, which prohibited transgender girls in particular from participating in high school athletics. This is a dog whistle to the far right, and it was used to rally the conservative base, which is really unfortunate because we're talking about such a small number of transgender kids in high school sports that just honestly want to participate. And so I think we were going to see more of that. We obviously saw some debate around prohibiting affirmative health care for transgender individuals in our state, transgender youth in particular. I imagine that's going to pick up steam over the next couple of years. And that really breaks my heart because we have made so much progress in the hearts and minds of people. And so I think that this is a reminder that we as individuals have to keep the foot on the gas when it comes to telling our stories, reducing barriers, exposing sort of the normal experience that we have with the world so that it's less scary to people, and that we need to continue to build allies in the community.
Mm-hmm. Yeah. And we can't take anything for granted. We just can't assume that because we've been rather comfortable with certain rights that we have taken for granted, that those were always going to be here. I think not to panic people, not to, keep you up at night, but I think vigilance is really critical for all of us at this time right now, because we are seeing a massive backlash to all of the progress that we've achieved here in the state and of course nationally as well. But to shift gears a little bit, we've been talking about the United States. I'm interested in how other countries have addressed this issue. I know some countries, I think France recently completely repealed that. Can we talk a little bit about what's happening around the globe with blood ban issues?
Yeah.
Dr. Bryan.
I'm not as well, versed on this one, but I do know that France and I believe Belgium and Brazil, and even, again, the United States, we can't be discounted. We've certainly made progress in the last 7 years, right? Going from an outright prohibition to 1 year and now 3 months. So, credit where credit is due there. But other countries have certainly stepped into this in a stronger way. I believe France if they haven't done it already, they will shortly. Maybe Matt has more to offer on that one. I apologize.
I am not super up to date on that either. But yes, we have some catching up to do from other countries.
What do you think that lag is? On my notes, I've got like Argentina, Spain, Mexico, Italy, Chile. They've all reduced this. What's the lag between the United States? Aren't we supposed to be the leaders in all of these in these areas? What's happening there?
Well, I think a lot of countries, they're smaller. They're they have better healthcare systems. They probably are better to respond. I mean, I think getting a national, coverage, universal coverage would probably help us make some quicker decisions long term. I just think that, the United States has a different approach to providing or not providing healthcare to the residents of our country. Greece is another story, right? I think, you're talking about just a cultural difference, I think, in the way that healthcare is provided.
Right. Okay. A question from the chat. Can Dr. Bryan speak to the other window period deferrals from the FDA in non-MSM blood donors?
What is that? Can you say it again?
Okay. Speak to the other window period deferrals from the FDA in non-MSM blood donors.
I guess I'm not understanding the question so much.
Are there other deferrals besides the men who have sex with men that the FDA?
Oh, there's probably, again, I'm not so up to date here, but it's there would be, if someone's injected drugs, injected substances that are non-prescribed, if they're sharing needles to do so. And I don't know the exact time frame of those, actually, because this is usually what I focus on.
Yeah. All right. So, and then Dr. Bryan, you work with Utah AIDS Foundation, and talk a little bit about your role there and the services that they provide, and how they're helping the LGBT community and other people to navigate health equity issues.
Yeah, well, currently, Utah AIDS Foundation, I'm on the board for Utah AIDS Foundation. They have lots of services. We have case management, there's a food bank, testing, HIV testing, and lots of ways to do that. But I think what's really exciting is kind of this future move into the more clinical side of things. So it would be able to provide more primary care, more treatment options, as opposed to just testing. And really the goal here is to provide another access point. You're probably tired of me talking about access being a problem, but access is a huge deal. So providing another trusted organization to provide LGBTQ affirmative healthcare in our area is a really huge deal. So I think I'm really proud of Utah AIDS Foundation for continuing to further care and close those disparity gaps and reduce the stigma for LGBTQ folks. It's really a vital, very important part of keeping our community healthy and vibrant and who we are.
Absolutely. And Senator Kitchen, your observations on the role of UAF in our community and how they're kind of lifting us up, taking care of us.
Yeah, I mean, I spoke to it a little bit ago, but I think, just creating that space where people can go, when you're going to Google and it's like you're panicking because you had unprotected sex, and then you woke up the next morning and feel a certain way and wanted to go get tested, right? You type in Google. Utah AIDS Foundation is a really accessible way for people to get some of their questions answered, because as Dr. Bryan mentioned earlier, a lot of times individuals who have experienced stigma in the past don't have a primary care physician, and maybe don't see a provider very often. And so you see organizations like the Utah AIDS Foundation and like Planned Parenthood and others filling a gap, especially for those at the lower end of the socioeconomic spectrum, which I think is really, really critical. And again, I spoke to this a bit ago, but I think it's so important. The professional nature in which the AIDS Foundation conducts itself in the community, and the way that they've been able to build bridges with unlikely partners is maybe one way of putting it, I think is helping to reduce stigma over the long haul. And I think that that's really important. During the session when I was working on this joint resolution, I was highlighting, of course, the blood shortage that we're experiencing not only in Utah, but around the country. But I also thought it was an opportunity for us to talk about some of the things that we usually don't talk about around men who have sex with men. And so I was able to work with ARUP and host a blood drive at the Capitol, right? And to get lawmakers and staffers and lobbyists and others involved in donating blood. Now, I, as a gay man who's had sex with a gay man in the last 3 months, I wasn't able to participate in the blood drive that I organized, but this is what we're trying to solve for, right? And so I think the AIDS Foundation is certainly one of many tools that we have in the community to help us affirm people's health, sexual health, right? And so I'm really proud to support the group and look forward to their new digs, new offices. I'm excited about that. Hopefully we can raise them a boatload of money and bring new people into the fold over the next couple of months.
Absolutely. Okay. Well, then, as we are preparing to wrap up now, I want us to leave on an optimistic note if we can. So I want you both to sort of weigh in on what gives you hope right now for the future and what you're looking forward to in regards to health and LGBT liberty and freedom.
Oh, I think in regards to health, obviously, this is what I do every day. I think organization, there's especially here in Salt Lake, here in Utah, I think we're moving in a really positive direction with LGBTQ health. Lots of our organizations that have already been around and trusted by the greater population sometimes have been viewed as not safe spaces for LGBTQ folks. And I think a lot of these organizations have started to recognize that and realize the negative effects that has on our community. And little by little, we are making progress in starting by just paying attention to it. This is an issue. What can we do about it? And sometimes they're really small changes. But those are it's the snowflake to an avalanche. It's going to make a difference. It already is making a difference. It's going to make a bigger difference. And so organizations like Utah AIDS Foundation kind of jumping into the pool of clinical care, I think, is awesome and is only going to help improve outcomes for everybody. So I'm excited.
Cool. All right. Final thoughts, Senator Kitchen.
Yeah, I appreciate the opportunity. From an optimistic standpoint, Utah has a really young population. We have the youngest population in the country. And so as I've engaged with Gen Z, young people, young people that are graduating high school or just entering adulthood and beginning to sort of orient themselves, politically speaking, to the world, I believe that, mental and behavioral health are certainly at the forefront of what they're thinking about. And I think that leads to better outcomes long-term when folks are aware of what their needs are or where the gaps in their healthcare services may exist, because then they go and advocate for them, right? And so I'm seeing a lot of young activists out there engaging in public health. I'm also seeing, behind closed doors in the Utah Capitol, Republicans talking about the importance of healthy lifestyles and the fact that perhaps abstinence-only education is not the best way to go in terms of public health long-term. And so I'm seeing more and more shifts toward affirmative healthcare. And again, I think part of that is the pandemic, allowing us to realize that, even those that look healthy may have underlying health concerns, and the fact that we need to be talking openly and freely with not only our healthcare provider, but with our loved ones about the situations that we're faced with so that we can seek the appropriate support. And you're seeing that in spades among young people. And so I'm feeling really encouraged by that. And I imagine that as they become leaders in their, occupational fields or step into the political space in a meaningful way, that will become more reflected at a societal level. And so I do have a lot of confidence and a lot of hope for what the future of health and healthy lifestyles might look like in a place like Utah.
Awesome. All right. Well, just going to wrap up our conversation today. Thank you so much, Senator Kitchen and Dr. Bryan. Thank you so much to the Utah AIDS Foundation for hosting this panel. You can get more information from them at utahaids.org. And you can check us out at equalityutah.org. And so thank you all so much for being change makers in our community.
Thanks to you both. This was fun.
All right. Take care, everybody.